Hello, welcome to PS with Jenn. I'm Jennifer Powell, the owner and founder of Powell Studio Beauty and Wellness and Powell Studio Academy. Today, we're going to be talking about all the things Sculptra and Radiesse and how biostimulators are changing the trajectory of body rejuvenation. If you have suffered from skin laxity, loose skin, loss of volume, things that don't align with how things are going in the face, then this episode is for you. When we talk about Sculptra and Radiesse, we think about collagen. I often refer to them as building blocks. I want to make sure that people understand the foundation of your home. So we use this analogy and we talk about having collagen-rich skin. We want to make sure that when we choose products, we're not just using things like dermal fillers, we're really getting to the root cause of aging. Collagen is the first thing that we begin to lose in our 20s, and then we end up thinking about the other structural support systems, so bone reabsorption and loss of the ability to support structural areas in the face. Well, now as we evolve as providers, we realize that collagen is head to toe and skin is needing support everywhere. It's been really exciting to see as an aesthetic provider how this collagen rebuilding has expanded over the different years of really trialing this in your space, working with clients that have different needs, wants, and goals. We're seeing throughout the industry different weight changes with the use of GLP-1s, and today we're going to break down all the different areas so that you can understand why these symptoms are happening and what to do about it. So with youthful skin, starting in our 20s, we're losing collagen more rapidly. That's why when we're young, our skin bounces, it's hydrated, the elasticity is wonderful, so that's where it's allowed to stretch and go back to its original form. And as we age, we lose all of these things. So we'll notice things like enlarged pores, our skin will be a little bit more sagging, we'll notice things like jowling in the face, but we want to talk today a little bit about how that trickles into the areas of the body. When people come in and they're addressing face concerns, we then start to look at how it affects the neck. We talk about the décolleté, we talk about arms and that crepiness, the change of the skin and the health, and then we talk about hands. Today we'll actually focus as well on the abdomen. The knees are a big concern for many people, as well as the thighs and the glutes. So when we think about Sculptra, we have one type of product. It is polylactic acid. It's a collagen stimulator that's going to drive an acute inflammatory response, and please don't let that scare you. When we create an acute inflammatory response, we're triggering the body to work harder and smarter. And so we want to make sure that it doesn't give up on us. It doesn't lower that collagen. It doesn't lower that youthfulness in the skin by having that continuous digression, that continuous loss of collagen. We want to stimulate it to stay alive, to stay firm, to stay triggered. This allows our pores to stay small, our skin to stay firm, the dermis to stay thick and supple. We want to make sure that we are not getting closer to the anatomy. That's when we start to notice more prominent veins and vasculature in the skin. This ages us more rapidly. And so when we use Sculptra, we'll inject that. It's polylactic acid A. It is mixed with bacteriostatic water. So what you're noticing initially is a volume restoration, but that water is going to reabsorb over 5 days' time when you are doing some of your post-care of massaging and keeping that product smooth and stimulated and not giving it the ability to lump and bump or clump under the skin. It had originally been created for HIV patients with facial wasting, and we realized that when they were originally placing it, it was more large boluses in the mid-face to help with hollowing and that debilitating facial wasting. But they realized that youthfulness, that confidence that it brought back was something that needed to be further investigated. So post-COVID, there was a relaunch. They've mixed it better. They've played with it more. They've used it in research. Because it is a product that lasts up to 2 years, we really want to make sure that we're placing it strategically. We're optimizing outcomes. What I've noticed as a provider is that sometimes people will get a single session. This does not shine when you only complete one single session. You really want to think about it as something that you do over a series, that you're stimulating the collagen to really be robust. And so with each session, you get about 30% correction of your collagen. And so we start at Powell Studio with 3 sessions of Sculptra in the face. In the body, we tend to do larger volumes, but we'll do it over 2 sessions. This allows for that correction to happen over time. We notice that Sculptra tends to get more obvious and more prominent and more long-lasting results in between your second and third session. It shines 7 months post your last session, where it's really fully established, your collagen and rebuilding, making your body do its own work instead of creating more of a fuller filled face with hyaluronic acid, or a full body underneath the skin injecting hyaluronic acids will restore volume, but it does not make your body do the same work of this restructuring and collagen repair and collagen rebuilding that your Sculptra will do for you. Sculptra is stimulating type 1 collagen, which is what we're most rich in. And so that's why our product is going to last up to 2 years, where you never want to keep starting over. So once a year, you'll do a booster in this treatment. The next product we're going to talk about is Radiesse. This is a calcium hydroxyapatite. This is another product. It is more viscous. It comes in a white form, where Sculptra is clear. It's mixed in bacteriostatic water. It's a powder formation when we mix it. It has little particles, but you can still aspirate and see through it and inject that, where our Radiesse is going to be more opaque. It's white. We're using this really, it can be used in all the same areas. I particularly choose to use it a little bit more strategic and differently. I only use the hyperdilute Radiesse in the office, but I do love that they're very similar in a lot of ways, driving collagen repair. Radiesse is a biostimulator. It's going to focus initially on type 3 collagen, but then continue to convert into our type 1 collagen. It gives you some instant gratification, where you're going to get that fullness, that lifting, that firmness right out of the gate, and it's going to stay, where your Sculptra is going to be the water that really dissipates, lays, and it almost like fertilizes the area where Sculptra can start to stimulate that collagen growth, but you may notice it goes back to where you started and then takes time to stimulate. Your Radiesse is going to stay. We use it a lot in the booty, and so making sure that people have lifting and firming and this projection or loss of hip dips that might make them self-conscious or not feel as great in a bathing suit or in workout pants. I know a lot of my avid runners are struggling to maintain fat on the body, and so they tend to be my most common patient in the office, looking to make sure that that projection and that support is not lost, because it really does balance. We give all these analogies of how your nose and your lips and your chin, well, think about boobs and butt. They're going to rebalance the whole body as well. And so when people lose that lifting, that projection, and that ability to contour the body, it really makes a big difference in their overall confidence. The Radiesse is going to be injected again, same over 1 to 2 sessions. We want to make sure that you have a strategic consultation and assessment. And so when you're thinking about this, we really want to make sure that we're thinking about how thick the skin is to start. We want to make sure we understand, do you have a timeline in which that you are trying to project this volume or improve this area, improve elasticity or crepiness? That would align with our timeline to treat. We want to make sure that we're choosing a product, if you need results right away that are going to continue to get better, we may look at Radiesse versus Sculptra. And if you're coming to me the year before that special event or wedding that you really look forward to, then Sculptra may be the better option. I look at choosing Sculptra and Radiesse for many different reasons. I look at that starting point. How thick is the skin? Is it translucent? How old are they? What is their immune system currently doing? Do we have any contraindications? We think about when I recommended or I mentioned that Sculptra was originally created for HIV patients with facial wasting. We know it works on everybody, but that doesn't mean everybody should have it. You want to make sure that your immune system is strong, that you can handle introducing this inflammatory response. And I always mention to people, we want predictable beautiful outcomes. And so that comes along with a strong immune system and making sure that if you had a recent vaccination or you have a procedure, dental, if you have a recent illness, that we really wait and make sure that all of that is repaired, recovered, that you've boosted your immune system, maybe IV hydration, you're having your supplements, you're making sure that you're resting, you're hydrated, and that you are back to your best self before we perform any of these services and treatments. We have the ability at Powell Studio to really drive beautiful outcomes. This treatment was just newly FDA approved in Europe, and so it's the future of aesthetics, but we have been doing this for the past 10 years. I feel so blessed to have had the opportunity to train with providers who were really the driving force of Sculptra back in its infancy. They were treating people in HIV clinics. They were really getting to see the pros and cons of different treatment protocols, different strategy around it, and have been the driving force for the continued research that Galderma has continued to work on, and making sure that we knew how to optimize it, and that it really is a beautiful product that's going to shine and continue to shine as we advance in its space of where FDA approved areas are going to continue to come to light. But we always think about Europe as a reference because they're ahead of the game. They're approving things first. Not everything is perfect, but when I see that they have FDA approved Sculptra for the body, you know that it's coming to the US before we know it. So as a provider here, I've always made the recommendation of, it's almost like the triple threat. We use the biostimulators to make sure that the skin is intact and firm, thick and healthy, where you can feel confident. We have our Venus Bliss Max that's going to help support tighten and tone and smooth and slim, making sure that people have that combination therapy. And we always want to make sure that our hormones are optimized. If you have low estrogen, testosterone, a lot of these hormones are helping to hydrate and keep the skin integrity intact. And we want to make sure that that collagen is driving before that we're trying to stimulate it with other things. We notice that driving the collagen and building that collagen, you think about trying to microneedle the skin. If you can get that Sculptra into the body first, you're going to increase your collagen by over 60%. And so in a very short period of time, within those couple of months, they say 45 days, you're going to have up to a 60% increase of collagen with Sculptra treatments. And so if you can think about organizing that treatment plan by driving that collagen there and then stimulating it superficially with microneedling or body contouring and smoothing, you know that you're going to optimize those outcomes and those results. So we have our Powell precision pathways that are for body confidence that have been an incredible opportunity for people who are doing the work, using weight loss support, that have struggled with their weight for so long. These aren't the answer if you're not going to do the work at home. So we think about those who are GLP-1 users who have had more rapid weight loss. And so these are wonderful positive things, but they come with this consequence of skin laxity and descent of the tissue. And so when everything feels like it's falling, we want to be proactive in these decisions and know, like, okay, I can lose this weight, but how do I actually preserve the body instead of feeling like I've lost this weight and now I need to pick up the body? These conversations have been so wonderful. I'm thinking about all my patients that I've actually already served and helped. And the longevity of these treatments has been dependent on lifestyle. So like I said, I have a lot of avid runners who can't keep fat on the body. They're really making sure that their activity level is on point. It's something that they're using every single day in their lifestyle and in their career. And so they're going to treat 1 to 2 times a year, depending on their schedule. Downtime does come with some of these appointments. So you think, we'll talk next about surgery versus biostimulation, because neither are bad, but there's pros and cons to all of them. There's a little bit of downtime. So when we have a procedure, I talked about maintaining the immune system, but now I really want to make sure that you guys have a handle on preventing infection. So we have this treatment that really comes with minimal downtime. It's, 24 to 48 hours, no exercise or working out, submerging into a pool or water, sauna, sweating, and this will prevent infection where you had injection sites. There's lidocaine in the products, and so it's pretty comfortable. It's very minimal. I would say people say it's more weird than it is very painful. Depending on the area, I think even in the glutes, you hardly feel anything. We can numb superficially. It's a pretty straightforward procedure once you're experienced and elevated at that thoughtful consultation to start. Treatment planning, the procedure itself is less than an hour. From start to finish. This includes important photographs. We want to see what we're starting with and our progress over time. People tend to forget where they start. And so keeping track of where you are, how close we've come to achieve your goals, and if this is what we need to continue to maintain them is really important. And I want to make sure that everyone is safe post-care. So Sculptra does have some homework to do after. I mentioned that it's polylactic acid. And so that's a sugar molecule. It can be sticky and lump and clump in certain areas if you don't do the post work of massaging up to 5 times a day for 5 minutes at a time for 5 days. There's some new evidence that maybe this isn't necessary, but I have seen a rare but a situation of different lumps or bumps that other providers have asked for support for. And why not prevent this? So if we have the opportunity to stimulate the product, to keep it smooth in areas of movement, it's not just the face. We're talking about areas that move all the time. So if we're talking about arms or hands, the upper knees or abdomen, we really want to make sure that our outcome is predictable and beautiful. And so this is what we recommend for post-care. Your Radiesse is not going to have that same post-care. It is going to be the same for workouts and infection risk, but you don't have to massage. It's going to stimulate the same because it's that different product. It doesn't lump and clump the same way. Lumps and bumps are not impossible, but I find that they come more often with a triggered immune system. So keeping that healthy immune system and making sure that we are optimized, rest, health, hydration, stress is really important to optimize our long-term outcomes and how beautiful these treatments stay. Trying to think of where else we want to conquer. So we treat in the upper body, face, neck with Sculptra. I want to go to the décolleté with Sculptra or Radiesse, depending on the thickness of the skin. In arms, I'm treating the upper bicep. This is for crepiness or smoothing, improved texture. Not often, but I have on several occasions done the forearm. I feel like the change there is minimal, depends. It can be impactful, but that's not a highly requested area in my office. The hands are a must. We notice that there's thinning of the tissue, that enhanced vasculature, that aging that comes along. And when we can give that little bit of love with the Sculptra or Radiesse in the hands, it makes a dramatic difference for people feeling more confident. We notice that when we hold our steering wheel, there's a lot of wear and tear that happens on the hands. So it's the sun, that thinness of the tissue, and our vasculature comes to the forefront right away. When I'm thinking about abdomens, a lot of that rapid weight loss or post-pregnancy. I've had a lot of post-pregnancy moms who are really trying to get their body back and feel confident and healthy. And because the baby has stretched and been supported over that 9 months period of time, we want to give it time for it to naturally retract on its own with exercises and support, maybe even physical therapy for that diastasis. But then we want to start to combat that with our Radiesse I use in the abdomen. And I'm going to structure that with some superficial microneedling that is going to also build collagen. So we're working deep and superficial. On the knees, I'm using Radiesse Hyperdilute, and that allows for not only that crepiness, but it's a lifting in that tissue. And so we notice that things start to descend, and we have not only crepiness, but almost some folding over of the knee space. And as we age, we want to make sure that that tissue stays nice and thick and supported, and so we can feel confident in those shorts and skirts. The booty building has been trendy in all different levels. So COVID, people were wanting to follow Kim Kardashian, get that big booty, lots and lots and lots of different syringes, making sure that we really maximized how full the booty was. And that took time, and it was an investment. But when we think about that, now everything is petite and little, but we don't want it to be flat and childlike. We don't want it to be lax or thin. We want to be shapely, and where we examine and can look at is not only the skin integrity and the skin health. So we know, like, do we need to collagen repair, build that scaffolding there, but also the volume loss. And so we tend to have hip dips. If you look at the lateral part of the glutes, we end up with a loss of volume there. And so starting in that space and then looking at projection post makes a big difference in your outcome. So we don't want to fix one or the other. And if you try and just create projection and don't fix the hip dip, then you're not going to get that beautiful rounded outcome that you used to have pre-children, pre-menopause, pre all of the fun things of aging. But it doesn't have to be a death sentence. We have options here. And I know for a long time people thought that they just had to accept what was there because surgery is a big deal. There's a lot of risk. It's actually, I think, the highest death rate to get some of the booty procedures that are out there. And I don't even think that they're any longer being covered by insurance because of the high risk. And I see a lot of providers who used to offer them who are doing less and less of them. And part of it is trends and aesthetics. Part of it is risk versus benefit. And every single day in the office, I'm always saying, listen, you can't try something once and give up on it. We really need to tweak and adjust. And these are things that we want to still support. We have these concerns. They're not going away. So what are our other options in order to build them and make sure that we feel confident and we're loving the outcome, but we also are safe and protected? So I hope that this episode helped you today. Sculptra versus Radiesse are two really beautiful products, slightly different, both hugely impactful. At Powell Studio, we've been doing bio stimulation head to toe for years and years and years with beautiful outcomes. There's no one answer. We love multimodality. We love teaching other providers how to succeed in this space. And if any of these symptoms of skin laxity, crepiness, or any other body part that you would love to elevate a little bit more resonated with you, we'll hope you reach out to Powell Studio so we can support you. And we look forward to seeing you at the next episode.